What are the different types of severe mental illness that an individual could be affected by or with?
The question becomes, what does an illness in mental health mean? Right?
Yes.
And that's what a lot of people ask about. I mean, the last mental health survey that was done showed almost 20% of the adult population in India has some sort of addiction, basically. So substances like cannabis, cocaine, heroin, all those things are almost 3 to 4%.
A lot of times people are reluctant to take medication when it comes to mental health. I know a lot of people who say, I don't mind talk therapy, but I don't want to take medication. What's your response to that?
Some conditions in which talk therapy will work and is sufficient. There's some conditions in which only medication will work. Some severity where only medication will work till a point that talk therapy can be effective.
Australia has just decided to ban social media for children under 16. What is your recommendation?
Exactly that. No social media for kids.
Okay.
Absolutely none.
It brings to the question of mental health for men, because there is a greater awareness now that men have fewer areas of expression of their feelings, and that bottles up into more serious issues. Is that something that you've witnessed in your work as well?
Yeah, absolutely. I think the narratives start from our early childhood, right? And then especially in carrying the burden and expectation of being more stoic, expectation of being more resilient, expectation of just grinning and bearing it. All of those things lead to a makeup often of saying, I should be able to deal with this. And the should is where the problem starts.
So you believe that the social behavior that women have, where they get together with other women and discuss what's going on in their lives, actually keeps them healthier?
Absolutely. I think more men should be doing that.
Doctors who are treating physical health will tell you that if you eat right and if you exercise and if you do these 2-3 things, you can generally keep yourself healthy. What is the mental health equivalent of that?
Absolutely the same. Absolutely the same. So eat well, sleep more than 7 hours a night, sleep between the hours of 10 and 7 usually, and so that you get night sleep. That's very, very important. Drink enough water, exercise regularly, get enough sunshine. All those things are helpful.
Dr. Malik, this is a conversation from, I call you Amit. This is a conversation that's so long overdue, because I think that talking about mental health and answering the slightly tougher questions is something that we need desperately right now in our society. My understanding is that you're currently working on viable solutions and treatment for severe mental illness, apart from all of the other stuff. And I'm going to ask you some really basic questions.
Please.
What are the different types of severe mental illness that an individual could be affected by or with?
Let me just start by adding some clarification notes, right? So I run an organization called Amaha, and I'm a psychiatrist by background, right? And so what we are really building is a solution, an organization that caters to mental illness across the board. But the way we are structured, it allows us to specifically cater to people with moderate to severe mental illnesses. The question becomes, what does an illness in mental health mean? Right?
Yes.
And that's what a lot of people ask about. I just like to break it down to 2 or 3 categories. Right? One is really illnesses of the mood. So things like depressive illnesses, what people know as depression colloquially, anxiety disorders, what people say anxiety or ghavrahat.
Yes.
That is the other sort of set. And then what people popularly describe as OCD in their normal behavior, but actually it's an illness for lots of people, which is where you have habits and thoughts that are very intrusive and sort of very uncomfortable. So there's one group of illnesses which are linked to your mood. And the second group of illnesses really is around where your sense of reality can be distorted, what are called psychotic illnesses. So schizophrenia, where you have an altered sense of reality from what you're actually experiencing, where you might be hearing voices or you might have false beliefs that people are actually out to get you. That's a very severe illness and affects almost 1.2% of our population. So that's the second group of sort of illnesses really. And third really big category in India, and I'm just talking the big categories, is addictions. Right? So a lot of people struggling with addictions. I mean, the last mental health survey that was done showed almost 20% of the adult population in India has some sort of addiction, basically. Right? And a lot of it is what we would call more regular.
Socially accepted.
Tobacco, but then a lot of other stuff that's more hard end. So substances like cannabis, cocaine, heroin, all those things are almost 3 to 4%.
3 to 4% of India's adult
Adult
population are addicted to some form of narcotic.
Some more serious substance, basically. Yes, sir. And then add to that the behavioral addiction elements now. So the new addictions around behavior. So gaming addiction, gambling addiction, device addiction. Right? So all of those things are the
Device addiction is a thing.
it's massive problem. Right? So when you look at these 3 categories, right? So the mood difficulties, which are like depression as a common one there. 60 million people in India have depressive illness. It's larger than most countries in the world.
And this is clinical depression.
Clinical depression. So and there's a 45 to 60 depending on which study you look at. And then looking at sort of the illnesses of psychosis. So sometimes depressive illnesses of psychosis. So as I said, very severe end of the spectrum. Then schizophrenia. So that group. And then addictions. 3 large categories of illness. And together they add up to about 190 to 200 million people in India with a mental illness today, essentially.
Yes, this conversation is going to take about 3 days.
I have time. I've been waiting hard for a long time.
Let me start with the addiction, and then for our audience also, we will talk about the milder, mental illnesses. We will talk about the severe mental illnesses as well at different age groups. If we just talk about addiction to begin with, in most of our cities, we don't have de-addiction programs like they have in the West. A lot of people drink socially. A lot of people smoke. There's a lot to unpack in that entire area. And we'll get to device, which I found very interesting. But in terms of alcoholism and just tobacco, how bad is the situation in India, and how difficult is it to find, to be able to quit?
There's a lot of stuff, especially in Indian males, that gets hidden as social drinking. But actually is problematic drinking. So actually what is problem drinking? And then, so the stages are where you go from drinking socially to then actually it becoming problem drinking, where you're drinking a lot more than you should be. The WHO recommends about 21 units of alcohol as a safe drinking limit. And so that's like
21 units of alcohol over
a week. But that problem keeps compounding, basically, right? So, and then a lot of Indian men that people know drink every day. And then that's a social pattern of drinking, which is clearly problematic.
A lot of times people will say, yes, I like to have a good time over the weekends because I work very hard, but I can stop whenever I want to. I'm okay. My family's okay. We're all okay with me having a couple of drinks. I'm a little hungover over Sunday morning, but that's all right. I can get it under control. At what point do we know that this is no longer an individual having a good time and this is someone who needs to stop?
I think there are 2 ways of looking at that. One is anywhere where it's affecting your functioning in any aspect of your life. Right?
Give me an example.
Relationships. You're getting into fights at home, right? Your work efficiency is going down. You're beginning to show up late at work, right? So those are the professional aspects of your life. Health, right? So you are beginning to start to look after yourself in the way that you wouldn't want to. So, for example, if somebody exercises regularly, but you stop doing that because you're waking up hungover regularly. Second is just absolute quantities, right? If you're drinking like half a bottle every weekend, then it's a problem. So there's a whole notion saying I don't drink over the weekend, but I don't drink regularly, and that's okay. Yeah. But actually, it's not, right? Because if you're drinking very heavily over the weekend, then actually it's probably harming you as well.
Right.
And that also might often is a precursor to other things. And we know, I know so many not just from professionally, but also socially, so many high functioning alcohol consumers who drink every day in large volumes and show up to work fine, and that sort of makes them believe that things are okay for a long period of time. Then suddenly they're not. And suddenly one thing will just tip it off and they'll fall off the cliff, basically.
Again, a socially accepted poison, because if no good can come of either chewing tobacco or smoking, right? There's, it's not the 1920s. We're not under the impression that it can be good for you in any way, but widely available. Everybody smokes socially. Where is that line?
Tobacco is totally unambiguous. It's just bad for you.
It's just
There's no good coming out of tobacco, and especially smoking and chewing tobacco. There's no good coming out of it. So there's absolutely. Both alcohol and tobacco are absolutely bad for you. I was saying that the harm with tobacco is far more obvious and proven now. And what's even scarier is there are kids starting a lot earlier, 5th, 6th standard, and they're starting with vaping. And that is a huge different problem altogether. My personal view, and this is not fully scientifically backed in because the science is still new on vaping, but is that we are yet to find out what we don't know. And a lot of us have anxieties that actually 20 years late from now, or 10 years from now, it's already beginning to happen with some of the court cases that are happening in the US. But 5 to 10 years from now, we'll talk about vaping as we talk about smoking today.
As a psychiatrist giving advice, how does one quit smoking?
With smoking especially, just have to stop. I think this idea of I'll stop over time and gradually and reduce it doesn't really work. And there's a lot of evidence around saying that I think the best thing to just stop and then use replacements for the dependence.
Before we get into the hard narcotics, I want to talk about young people today using, I don't know, ADHD medication to focus during their exams in order to perform better. And that forming a separate sort of entire category of addiction that's perhaps a space that we haven't really looked at. Is that something you're encountering as well?
I don't work with young people very much, but we have a children's part of the organization called Children First. And so yes, where we've heard it, absolutely, we've heard about it. I don't know the size of the problem. It's a problem that's hidden. I don't know the size of the problem. Do I think it's harmful? It's very harmful, right? And actually, it's a more deep-seated problem, right? The tendency could be to look at this child and say, what's she doing or what she's doing, but how did they get there? Right? So actually, for me, the conversation is more about the academic pressures, the expectations set, the societal peer norms that actually get you there in the first place, where you think you have to pop in something potentially harmful to achieve something.
Yeah.
Right? And I think that's what we need to work on. Yeah. If I need to do well at this exam or at this test at any cost, then I'll figure out a way of doing that.
How did we convince the teenager that they need to perform at all costs? That's the problem, in your opinion?
How do we create that mindset that achievement became the be-all and end-all of life, basically, right? And that is not a child's problem. It can never be. It can't be a 14, 15-year-old's problem that's how they feel.
So, on this subject, right, and you've practiced a lot in the UK and then you moved to India to bring your expertise to India. We have a specific problem in India of mental health issues with students, young people who are in that 9th, 10th, 11th, 12th entrance exam, college space. What are we doing wrong in India? Because I know that this is every parent's worst nightmare. What are we doing wrong in India?
I think children, it's not the right word, children really and young people really learn from what they see around them. So the vocabulary they pick up, the expectations they set for themselves don't necessarily come from within. They come from around them, essentially, right? So I think it's the challenge starts in their ecosystem and not within them most of the time. And at Children First, the work we do is really believe strongly that the problem is not the child, it's not sitting in the child, it's really the
environment.
The environment and the stakeholders need to come together and figure out the problem first and then the solution. What is the language we use for mental health? What is the language we use for what success means? What is the language we use for what would good look like and what would terrible look like? How do we drive fear within like as to what would happen if? So I think all those things are what then play into the psyche of a 13, 14, 15-year-old. Right? And then we're talking about just fascinating articles about what's happening in Kota, right? And you talk about administration changing fans and terrible public ridicule of their effort, right? So let's just start by addressing that.
So as a recap to our audience, when there was the issue of too many deaths by suicide in Kota, the administration decided to change the ceiling fans so that they cannot support the weight of a human body and the fan cannot be used to take a life. And again, there was a lot of criticism.
So I don't agree with the criticism.
You don't agree with the criticism?
Okay. So I think that so first of all, let's put it differently and say that it's admirable that the administration was trying to do something.
Okay.
Right.
At least they did something, or thank God they're doing something.
No, at least both actually, and because thank God they did something, and at least and at least I know because we had a bunch of conversations with them going back 5-6 years ago. So I know they've been very aware of their issues and trying to work on it. Right. Now there's clear evidence that actually changing these last mile attempt, access to attempts to harm yourself has a huge impact on suicide rates. So I'll give you some examples historically, right? There's a bridge in the UK where people should jump off from, and they put a netting up there, and suicide rates in the area went down. So there's lots of evidence in this stopping or minimizing access to last mile deterrent. Yeah, okay. It has an impact. So it's the right thing to do. For the administration, it's the absolute right thing to do. Say there's one deterrent. A lot of people are doing it this way. There's one deterrent now. That doesn't mean other things will not happen, but it does impact suicide rates. Right? That's one thing. The problem started a lot before people got to Kota.
Yes.
The problem started when kids were like, think of this whole journey of this child, right? Where a lot of them come from very modest backgrounds, and now they've gone through a journey where parents have given up a lot, right? And we hear the stories of parents selling the real assets and loaning and mortgaging their jewelry and their property to take loans to send kids to these courses because they think it's good. So all of this, what they're doing their best to support their child, but now the child is carrying all this on them.
So, as a parent, and I also realize that as the media, we tend to romanticize these sacrifices that parents make and, how they give up everything for their child. But on one hand, there is this idea that I have a child and I will give this child everything. But on the other hand, as you're pointing out, what that child has, that's this burden of if I fail, I've let them down and, I'm the only hope and stuff like that. So
I think everybody has to do what they have to do.
Yeah.
Right? As a parent, I would like to give the best to my child. And to the best of my ability, I like to give them whatever I can, right? So I think that's the problem. Doesn't lie there. The problem is in the stories we tell ourselves and we tell our children, basically. I think it's about how we see that sacrifice and how we translate the sacrifice into our conversations is what in turn gets internalized by a very impressionable mind, essentially.
Give me an example of that vocabulary.
Exactly what you said, right? We just said, I have sacrificed everything so that you could become something.
Right.
If that's the narrative that the child is carrying with them, or is saying that, no, this is something, or normalizing that. I mean, even if you did that, and normalizing that in a conversation and allowing the child to develop holistically. See, some degree of pressure is important, right? Because
without pressure, going to ask you.
Without pressure, nobody performs. But how do you actually get it right by telling the whole story? Not just making it about that pressure, not just making it about that one outcome. How do you talk about how important it is to be a good human being? How important is it to have relationships? How important is it to have physical health and mental health? How do you have those conversations along with saying you need to do well exams?
The other challenge with parenting, again, that I talked to a lot of parents, and you talked about device addiction, right? At what stage do you allow your child a device? At what stage do you allow them social media? Australia has just decided to ban social media for children under 16 because it is a scary outcome to raise a child who is watching the whole world and being watched and judged by the world at the same time on social media. Where, what is your recommendation?
Exactly that.
16?
As simple as that. I think just like tobacco, I don't get any ambiguity about this. No social media for kids.
Okay.
Absolutely none. I think this one is not. This is absolute share. I think the evidence around just as the alternate reality, the kind of loneliness and FOMO it creates with kids, the kind of how that leaves them feeling inferior, it's just too overwhelming. I think what we've seen since COVID is it's gotten worse. And a lot of conditions like eating disorders in young girls and a lot of self-harm in young people. Social media is definitely one of the contributors to this issue. So for me, it's an absolute, I completely agree with that policy. And plus now it's so dangerous now. With a lot of the stuff that's happening with AI, putting your child out there, and so much stuff can happen in terms of modifying images and then bullying around that, and it's already happening. So you're putting a lot of your child at risk by putting them out there in this way and letting them access social media in this way.
What is the age recommendation for you for social media for children? 16, 18?
I would say as it is possible, but definitely not below 16.
If we talk a little bit about the mood-related disorders that we started with, right? I think that anxiety has become either better known now, better detected now than it was when our grandmothers used to say, "Ghabrahat ho rahi hai," and we didn't really know what that was. How does one tell the difference between I have anxiety, I need to have this looked at, or I'm just reacting to my environment right now and I'm having a stressful period in my life? Where's the difference there?
I think I'll put 3 fundamental rules to this for all mental illness. Right?
Okay.
And
And so this applies to anxiety, it applies to
everything.
depression, it applies to everything.
Everything,
Okay.
right? And I think one is really about duration, second is about functioning, and third is about why take a chance. So the first one, I mean, when I said duration, I mean if it's carrying on for, let's say, more than a couple of weeks,
Okay.
I think it's time to take it seriously, right? I think the second was really around the functioning. If it's affecting your relationships or work or health, even after all this, both those you're not sure, just see somebody anyways. See a good practitioner, most times they'll tell you this is okay. You're fine.
Yeah, you're better off knowing that you're fine.
Yeah,
then.
exactly. And then why?
What happens if anxiety is untreated or not looked at for a long period of time?
It has consequential effects, right? So it keeps getting worse. Right? For a lot of people, it just keeps getting worse. And what happens then is that it starts affecting other parts of your life, which then has a knock-on effect on your overall life itself, which then has effects back in your anxiety and your mood, basically. So it's almost a circular thing. So, for example, if you're very anxious, you respond, let's say, by either withdrawing or reacting, then that's affect your relationships, or affects your work performance. Then you might affect how your life is going, or you might lose a relationship, and then that makes your whole life worse, and that makes you feel worse. This sort of vicious cycle then keeps sort of perpetuating. So actually what happens is with some of these disorders, the impact is really on the rest of your life, and the consequences are beyond just on the mental health. And so some of those then become irreversible. Your relationship ends, right? So, or you lose your job, essentially. So actually, which is why it's important, and also the evidence is quite clear, right? The sooner you address any of these illnesses, the better the chances of full recovery are. The longer you leave any of them, a lot of them will get severe over time, or more severe over time, and secondly, they'll have more long-term consequences. They'll be harder to treat. Outcomes will be poorer. So that's very, very unambiguous, essentially.
What is the difference between just depression and clinical depression? At what point, again? Okay.
So, but I think what people often confuse is sadness and depression.
Okay.
Right. So I'm feeling a bit low and sad, and again, for me, that's the same definition. I think if it's carrying on within a couple of weeks, if it's affecting your energy levels, if it's affecting your ability to function, your level of enjoyment, if it's affecting other parts of your life, you're not able to function as well, I would just get it checked out. If you're feeling sad, it doesn't matter actually, there's a reason for you. It doesn't have to be irrational sadness to be depression.
Okay.
It could be just rational sadness, but if it's carried on for a long time, and I've said long as 1 or 2 to 3 weeks, and is affecting your ability to function, then it's worth getting it checked out. So I think for me, it's more that, even if there's a reason for it. A lot of times they justify saying, obviously I'm sad because
this has happened to me.
Yeah. That's okay. That's why a lot of these things happen in the first place. So I wouldn't discount your feeling and suffering because you're justifying it by something that's happened basically. I just got divorced, so it's okay. I will obviously be depressed. Yes, but if you should be sad, but if you've been feeling like that for 3, 4, 5 weeks now, ongoing as affecting your ability to function, then you should see somebody.
Because a lot of times, like you said, incidents like divorce, separation, or grieving, when you lose a loved one, when you lose a job, these tend to have longer periods of emotional recovery, right? But you're saying even then,
you've just been 3, 4 weeks, you're feeling very low and you can't function. It's absolutely understandable. I'm not saying that at all. I'm not saying there's something wrong with you. It's absolutely understandable. And I think that's one of the problems that happens. We ascribe blame and labels to it, right? But it's also absolutely fine to seek help to get through it.
If we were to talk right now about the possible, solutions when we go to see someone, and I was having conversations with the people around me, and the feedback was it's so expensive. Therapy is expensive. One person told me that they were charged 4,500 rupees for 45 minutes. And so 2 sessions knocks out their monthly budget. And she's like, I couldn't sustain it. It was just too expensive. Why is it so expensive?
I have a egalitarian view of it and a slightly more controversial view of it. I'll give you both. I mean, it's expensive because that's the currency in which people are getting paid is time, right? And,
Yes.
and you're seeing a professional who's probably worked for 20 years to get there. And they can only have just so many hours of clinical work in a day, so they need to get paid. So that's why it's expensive, right? But actually, it's not all at that price point. I think today, with a lot of stuff being available more ubiquitously and online. And I mean, our price point start at like 1,000 rupees, 1,200 rupees for an hour, basically, right? There's and we also go up as high as 6,000-7,000 rupees an hour. So it depends on
On the service that you're
services seeking, the professional you're working with, and so all depends on lots of things, basically, right? So the first thing to say is that actually there is a range of options available. Second, a lot of therapists and a lot of organizations will also work with you and find like a sliding scale of payment, or they will offer you discount something so that they can see you through treatment. A lot of people want to make sure you get better, so they'll work with you. That's the second thing. And there is a lot of things you can do for yourself with self-help alongside therapy that will also access. So if you are good about, sorry, good is very judgmental again. If you work in partnership with the therapist to do the work you're supposed to do, you can also move the journey more effectively. So that you're not be as long as.
I do want to ask you this, though, and I know that I understand it's an impossible question, but I ask it. How do we tell the difference between a good therapist/psychologist or one who's not so good?
That's the whole podcast on its own. I'll tell you why I'm saying that, because I mean we were looking at data for something last month, and we got 1,700 applications of trained psychologists at Amaha in the last quarter. They recruited 38 of them. So basically what I'm saying is there's a lot of people out there who are still, and I don't think that it's good or bad, I think they're still developing skills. So I think like a lot of people, that's not true. Some people are not as very good, but most people are also still developing in their careers and developing skills, and hopefully they also get better over time.
What qualification should I ideally be looking for?
For a clinical psychologist, you need to have an MPhil in this country. So an MPhil is a must for a clinical psychologist.
So does this person need to have gone to medical school?
No. The difficult journeys are an undergrad, like a liberal arts undergrad, to be a BA in psychology and then an MA in psychology, and which is usually a MA in clinical or counseling psychology, and then an MPhil is what most people do. MPhil in clinical psychology is most straight line journeys, basically, right? So no, you don't have to go to medical school to be a psychologist. You have to go to medical school to be a psychiatrist, who can then prescribe medication, and then so that's the difference.
A lot of times people are reluctant to take medication when it comes to mental health. They feel that it might be addictive, or it might mess with my brain. I won't be able to come back to normal. So I know a lot of people say, I don't mind talk therapy, but I don't want to take medication. What's your response to that?
So let's split this into two parts, right? One is somewhere is justified, right? Because there is definitely, first, in some pockets of practice, both here and abroad, over-prescribing that happens, right? But that's an exception. For most people, for most conditions, if gone by scientific evidence and prescribed by guidelines, medication are helpful, right? And they can do a bunch of things. They can help with treatment, symptom remission. They can reduce the symptoms and bring you to a state where you are in full remission faster, right? Your treatment is accelerated, your suffering is alleviated. So as long as the medications are provided in the right, or prescribed in the right dosage for the right condition based on scientific evidence and guidelines, I think people should take them, right? Now, there are a lot of myths around them. All mental medications are addictive. They're not, right? And some are, which again, but those need to be prescribed within those guidelines. Then they won't be. Right? So again, the rule one doesn't change. Prescribed based on evidence and by guidelines. So that's the rule one. Second is that all medication will have very severe side effects. Not all of them do. Some of them, and actually a lot of them, are fairly mild medications, especially medications that we use for anxiety and depression, are actually don't have too many severe side effects for a lot of people. Some people will have a more severe side effect, but a lot of people tolerate them very well. Some people have side effects that happen only the first couple of weeks and then settle down. And for other people, other medication can be tried. But again, on the cost-benefit basis, the symptom alleviation or reduction in symptoms is so much that is worth trying the medication if your psychiatrist genuinely believes that they'll be beneficial for you.
I do want to talk to you now about suicide. India has, it could be the sheer numbers, but we do have really high rates of suicide among, like we talked about, students, homemakers, farmers. And I know as a journalist that farmer suicides get attributed a lot to financial distress and not to mental health. Again, as a society, are we doing something wrong? Are we not seeing the signs? Do we not have the infrastructure to support people around us? What's happening?
One is there is a huge degree of across the population. There is a lot of suffering of multiple ways, right? So either it's farmers or as homemakers or as students, they're all as a group experiencing different types of social or psychological challenges that are very prevalent in those populations. So I think the prevention of it, this is the only really is at a much more ecological level. You have to go back and say, okay, what do I need to do to prevent farmer suicide? It's almost going back to a sociological experiment around benefits and subsidies, and I don't even understand this space very much, right? But goes there, right? With the homemakers, it's about gender disparity. It's just really about domestic violence. It's about the whole sort of sociological imbalance between not just genders but different women within the household. The etiological and remedy factors for suicide for a lot of these cohorts and groups are very much rooted in society and have to be pulled out and then dealt with individually and separately. And because that is so hard, the solutions are not always visible.
Are there normally signs of smaller forms of self-harm leading up to it? Is it just it tends to be a one moment of helplessness?
There are signs, right? And I think people talking about the futility of life or just the impossibility of life, or one of the biggest predictors for me is sense of hopelessness. If I don't see any hope in the future, if I see myself as a burden of any sort, I think those people talking about those things, people giving away prized possessions, people trying to make final arrangements, all those things are signs to watch out for in somebody especially who's struggling. Right? So I think there are signs that come through. Sometimes, infrequently, it's also just very impulsive and it just comes out of the blue of somebody. A lot of times, especially when it's linked to mental illness, there are signs. There are signs of low mood, there are signs of agitation, there are signs of irritability, sometimes lack of interaction with people. But a lot of it, if we pull it out, it correlates to sort of sense of either hopelessness or being a burden, or the degree of lack of control and helplessness. And those become very, very important things to look out for and watch out for, essentially.
We've recently had a case of a young person in Bangalore, a man who put out a very elaborate video and wrote out a very elaborate note before death by suicide. And he talked about the fact that, he was being harassed by family members, and the details of that case are available. But it brings to the question of mental health for men, which is where our conversation actually stemmed from. Because there is a greater awareness now that men have fewer areas of expression of their feelings, and that bottles up into more serious issues. Is that something that you've witnessed in your work as well?
Yeah, absolutely. I think, just sort of letting back on the case just for a second and saying that every suicide case is a preventable tragedy in some way or the other, right? And this one is no different. The narratives start from our early childhood, right? And then especially in a lot of households in India about how men are treated differently, and even from when they're young boys, to how both in terms of access and privilege, but also then how that at some level translates into carrying the burden and being more stoic, being more resilient, expectation of being more stoic, expectation of being more resilient, expectation of just grinning and bearing it. All of those things so lead to a makeup often of saying, I should be able to deal with this. And the should is where the problem starts. That is where I am setting expectations of myself that might not be realistic, and then the failing in those expectations creates a sense of failure, and that failure over time leads to a sense of hopelessness, and that's when can lead to the ultimate tragedies, right? And the idea that I can't fail, because everything relies on me, everything sits on my shoulder, is something that gets inculcated in the stories we talk about at our families, from our grandfather's time and our father's time. And so those stories get buried in. And so then those stories carry through. And even in today's world, those relationships that men have with their ecosystem, whether it's other men, with are often not very emotion based in an externalized way. Actually, right? It's often very so situational, or but we don't express our emotions a lot. That is not how we have our conversations, and apparently women do, but men don't. I think that itself takes the space away. But first saying that actually we've told ourselves these stories over a period of time, and that is why the stats are interesting. We see a lot more completed suicides in men from a statistical perspective. So in India, completed suicides in men are a lot higher. I think it's almost a 3:1 ratio. I'm not sure the number, but that much higher compared to women in all age groups except for below 18, where women are slightly higher. But I'll double check my stats. But having said that, these are reported stats. Lot of homemaker suicides get reported as accidents. So there's people who believe that those stats are a bit confounded from how the reporting is done basically. But so we see a lot more completed suicides in men, a lot more access and help seeking behavior in women. So more women on treatment, more women seek therapy, but actually more men end up killing themselves basically.
So you believe that the social behavior that women have, where they get together with other women and discuss what's going on in their lives, actually keeps them healthier?
Absolutely. I think more men should be doing that. I really literally think that if more men would open up to each other, or to anybody, I'm not saying more men would open up to other women as well, that's fine. But if more men would open up, I really think that would help. Absolutely. There's no debate about that in my mind.
I do want to talk to you about geriatric care, or care of our senior citizens, because I know that this is something you've personally spent a lot of time on. And also given where we are in India and we're caring for, aging parents, it becomes a really important thing. I was struck by something I read Ratan Tata say, that he was at the peak of his influence, per se, and when he retired, he was shocked at how lonely he automatically became after retirement. And he didn't realize how, what a switch. It was a binary almost. Is loneliness the biggest thing that affects our senior citizens?
I think it's loss.
Okay.
I think it's loss of so many things, right? So as we grow older, we lose people around us. We lose our jobs or our professions or our status or our engagement, sometimes our physical health, companionship. There's so many losses that keep compounding as we get older. And that's what they find the hardest to get to terms with, which is quite understandable. And I think that is what affects the mental health more than anything else, in my view, essentially.
When we consider now, a lot of us have parents who are living away from kids by themselves, senior citizens, just the two of them, sometimes just one. What would you say they need most of all?
It's a fascinating conversation. It's a fascinating area of the work that's being developed right now, right, in India. There's an absolutely amazing company called Antara, working in Delhi, and they have a huge place in Dehradun, and now they're opening in Gurgaon, and we do work with them on the mental health side now. And the whole idea of saying, how can you create communities of care? How can you create communities where people can support each other and can get support that they need on a daily basis, so that they can have active, engaged lives? Because we know that what is really needed is activity and engagement in a meaningful way, not in a patronizing way, not ke I'll ludo khel lo, or travel khel lo. Like actually something that engages that person. How do you create communities where people can find their own meaningful activities? These are people with just to take a step back and recognize who we are talking about.
Yeah.
These are people who have spent lives doing something, have amazing life experience and amazing memories, have their own tastes, have their own choices, and suddenly it feels like our own choices, our own tastes have to be imposed on them, basically. If we can create supported autonomy, where actually they can still be autonomous, but have the right support for physical health or safety or whatever is required or functioning required, that is what is needed. And that is what people like Antara are doing. I think they're doing a fantastic job. And then step it up, right? Say, okay, you can live independently, and then we support you at home, but then you can live independently, and you can live independently. So but you will live with other people around you, so you can live in a community, or actually you need more support than that. So you can live either in a more residential setting or a nursing setting. So depending on what that person needs, having the social and the health setting to be able to support that with as much autonomy and independence as possible, so their own choices can be enabled, and treating them as individuals, because we start infantilizing people as they get older.
What are the biggest mental health risks for senior citizens right now?
We see a lot of depression, right? So depressive disorders are a big challenge for senior citizens, and more prevalent than adult population, by the way. So you see more depressive illnesses, and that's largely linked to the losses, but also how your brain is now getting affected by age and other factors. You see a lot of depressive illnesses in senior citizens. We see a lot of dementia, sort of people with memory difficulties and other sort of functioning difficulties linked to sort of brain degeneration over time. That's the other thing you see. And then you see physical health causing confusion and what we call delirium, which is a more acute condition. Where
Explain that.
basically, if you have a physical illness and your biomarkers are all over the place, whether if you're dehydrated or you have an infection, then that can cause confusion, hallucinations, and that itself can be very scary and life-threatening, basically. That's a more short-lived condition, but we call them the 3Ds in the elderly. So depression, dementia, and delirium are the 3Ds that are sort of the key problems of mental health that we work with in the elderly age group, essentially.
The basic question I do want to ask you is, when we're talking about mental illness or severe mental illness, where does that come from? Is it genetic? Can I pass it on to my kids? Is it event related, or is it completely unexplained as to why someone would develop, a bipolar disorder or schizophrenia, and why somebody else would not at all? What do we know about that?
I'm going to give a very boring and non-helpful answer, which is that they're multifactorial illnesses, which means that they stem from a range of factors. Some of them are genetic, some more than others. Some of them are...
Which ones are genetic?
So bipolar disorder, for example, you'll see slightly greater genetic component compared to other illnesses. You'll see a bit more genetic component in Alzheimer's. You'll see a bit more genetic component in schizophrenia. So some of them are more genetic, basically. But all of them, and this is just relatively more, right? But all of them are genetic, have a genetic component to them. There are environmental factors, there are physical health factors, nutritional factors, a bunch of variables that play into it. And usually at the point of it first presenting to a healthcare professional, you will try and identify a trigger. Sometimes it's possible, sometimes not possible. Sometimes you find out actually somebody just developed the illness and there was actually no obvious trigger. And oftentimes you'll find, okay, this is what tipped the balance. So that's not the cause. That's just the trigger that is finally tipped the balance. But there are multiple things that have come together to really lead to that, essentially.
Doctors who are treating physical health will tell you that if you eat right and if you exercise and if you do these 2-3 things, you can generally keep yourself healthy. What is the mental health equivalent of that?
Absolutely the same. So eat well, sleep more than 7 hours a night, sleep between the hours of 10 and 7 usually, and so that you get night sleep. That's very, very important. Drink enough water, exercise regularly, get enough sunshine. All those things are helpful.
I want to go back to the sleep, because I know that there are a lot of people who don't manage to get those 7 or 8 hours for various reasons. And you did say sleep at night, not during the day. Tell me why.
That's been shown to be the best time for your body to get the rest, and that night sleep is very, very important to maintain health, maintain your stress, maintain your emotional balance. All of those things is very, very important. So over a long time, not having night sleep is harmful for you, essentially.
What happens? I mean, there are a lot of people who sleep at 3 and wake up at 11 or 12 noon. That's not good enough.
No.
So just counting the number of hours is not good enough.
And I'm just quoting evidence from what we looked at, and sleeping at night in those hours of 10 to 6, 27 is important, essentially.
What happens if we go a long period of time without getting that sleep?
Just start getting more irritable. Just your stress levels go up. You had more risk of developing psychological difficulties, sometimes metabolic difficulties. All those things happen with the sleep is key to almost everything, basically.
I mean, we did talk about the pressure that men are under. I want to introduce the other category of women who are trying to do everything, which is the jobs, the homes, the children, the school, the PTA meeting, the organic groceries, all of it at the same time, and not sleeping 7 hours as a result of it. What's the mental health impact of that?
I think I have to be careful here. The idea is people have to make choices. I think that is the honest answer for me. I think the idea is people to make choices between how do they prioritize the mental and physical health, their careers, and what their personal life needs to be. I think when I look at that tripartite of like mental, physical health, personal life, and careers, you have to then keep striving to find the right balance, and perfect balance never exists for anybody, right? And I mean that's not true. Some people find it, but most of it doesn't exist for most people, right? But if you can at least identify that you're playing with these three variables, that's the first step. And then you say, at this point, what is more important for me? Okay, then I'll sort of work that, and I think so over time it has to balance out.
Thank you so much for your time. I've obviously not run out of questions, but I think we'll need a follow-up episode.
Love to be back. I'd love to talk about mental health as much as possible. My whole goal is to get as many people to talk about mental illness, mental health, so that more people seek support and seek support early.
Okay.
And whether it's to do it at Amaha or not doesn't matter to us. But as long as seek support early, that's what we really care about.
Thank you. Thank you for speaking.
Thanks.